Great. Thanks for coming back. Hope you all had a great lunch. Our next speaker is Dr. Jared Skowron, naturopathic physician. He's the vice president of the Pediatric Association of Naturopathic Physicians, and he comes and joins us from Connecticut. We're really happy to have Dr. Jared Skowron join us today talking about Trehalose, which is a really new and exciting treatment that can help our kids. And so let's welcome Dr. Jared Skowron. Thank you.
Thanks, Dr. Pearson. I'm really, really excited to be here today. By a show of hands, who is the first time for this conference? Okay, good. Me too. It's my first time here. I've heard so much about it. I've heard that for so many people, it really is life-changing. So I truly hope that you guys are coming here with questions and you're able to find that answer that can change your life. And, I was listening to Dr. Pearson's lecture and, with all the potential for thyroid treatment or whatever it is that you find. I really hope you find it. So I am a clinician, and I've been in practice for over 10 years working with special needs kids. We see mostly kids on the autism spectrum. We do see a fair share of kids with Down syndrome, but it's really great to do everything we can to help the kids to fulfill their potential and to help the families be as happy and as functional as possible. So I'm going to come at you from the viewpoint of a clinician. I know when you come to conferences, you usually get the clinician viewpoint or the researcher's viewpoint. So I hope that my experience over 10 years with what I've seen work will help with some of your kids. So a little bit more about what I've done along my journey. I wrote an Amazon best-selling book, which is a natural health guide for kids. So if you're interested in natural medicine for your children, 100 natural remedies for your child. It just was published in Romanian last year. So for the 3 people who were there who will look at it, you read Romanian. As Dr. Pearson noted, I co-founded and am current vice president of the Pediatric Association for Naturopathic Physicians across America. I'm also an advisory board member for the Autism Hope Alliance. And this July 2014, I'm launching a supplement company that specializes in supplements for special needs kids because there's things that I use in my practice but aren't available elsewhere. So I really want to bring what works for me into the hands of everybody. Hold on, I got one of these. I got lights. Boo, boo, boo. Okay. Can you see that? All right. So the first thing I want to talk about, if you've seen the movie City Slickers with Billy Crystal, Jack Palance, one of the major themes of the movie is that you've got one thing in your life that makes your life great. And you've got to decide what that one thing is. Maybe it's your child. Maybe it's your family. Maybe it's your passion. Maybe it's your job, whatever it may be. But you have to make whatever that main thing is, the main thing of your life. Okay? And once you make the main thing that consumes what you do throughout the day, everything else is going to fall into place. So I hope that, if your main thing is helping your kids, that I'm here to help you guys. So there's 5 things I want you to do for me today. Okay? The first one is be hopeful. Because I see so many parents who come in and have so much negativity from other people, whether it's other family members, whether it's the internet, whether it's their pediatrician. And there is so much that can be done to help all children that you want to do as much as you can. I mean, as a parent of a child myself, we would do anything for our kids. So always think and always believe, I always believe there's always an answer to every question. We just need to figure out what that answer is. So please, number 1 out of 5 today, be hopeful. Excuse me. I want to start out with a clinical story from my office, a story about the boy who couldn't go alone to the bathroom, or how did I phrase it? The boy who wouldn't pee alone. Saw this 7-year-old boy with such severe anxiety, he would never leave his mother's side. They co-slept for 7 years. When he goes to the bathroom, Mommy, you've got to come with me. Mommy had to quit her job so she could stay home with him the whole day. And obviously, this anxiety doesn't just affect him, it affects the entire family. Okay? So we've got 2 parents who could never be alone together for the past 7 years. We've got other siblings who are involved, and it just escalates and escalates. And I'm sure those of you at home know when you've got a child that can dominate the power struggle of the family, it gets really difficult. Difficult for the whole family at large, difficult for you personally, difficult for your relationship with your spouse. It makes things really, really hard. So what we did for him was part of our normal testing we do. We do neurological neurochemistry testing, cortisol, thyroid testing, amino acid, and nutrient testing. We found out for him, genetic testing, which we'll get into, what we found out for him specifically, and everybody's a little different, was he had a problem making the neurochemical called GABA. How many people have heard of GABA? Okay, fair number of you. GABA acts as an anti-anxiety calming agent in the brain. So we found out he was low in GABA. We found out he had a hard time creating that from the protein in his diet. So we gave him GABA. And a couple days later, the mom calls me and said, "What have you done?" I said, "I don't know. Is this the wrong number? Is it?" She said, he's okay. He's happy. He just played downstairs alone for 30 minutes while I was upstairs, which never happened. When we were in bed, they still co-sleep. He said, but we were in bed lying together. He talked about how sad he was that their dog died. And their dog died a year ago. He'd never opened up and shared about these things because he was so scared. So the point of the story is that huge changes can come when you know the one thing that is the base of the problem. Again, like I love the videos that you showed, Dr. Pearson, of the child walking, and what was it, 3.5 weeks with before and after thyroid treatment? What a difference. So when you find the right one thing, those changes can happen. The hard part is finding that one thing. So what I do want to talk about today primarily is one specific biomedical treatment that I think is very new on the scene and very exciting. And it has to do with treating scar tissue or plaques, known as amyloid plaques, within the brain. So this is a little graph here that shows how the brain, down here at the bottom, this is the cell membrane of the neuron, creates these little chemicals called APPs that then create a plaque. So I'm going to use the metaphor of my new shoes. Here I have my new shoes. I'm coming to Autism 1. I'm excited. And I start walking around Chicago, and my new shoes don't fit my feet very well, so I develop a callus. Okay? Why did I develop the callus? Because these shoes are putting certain pressures on my foot, and my foot said, that hurts. So I don't want it to hurt anymore, so I'm going to develop all the scar tissue, and now I've got a callus. And what is the point of that callus? The point of that callus, because my body's making that callus, is so I don't hurt my foot. Okay? So this is what's happening in the brain. We have callus, we have scar tissue that's being built by the brain for some reason. We don't know what that reason is yet, but we'll get there. Okay? Now the problem with my callus is that I don't like it. Okay? It's pretty much cosmetic. It feels a little funny. Okay? Maybe it hurts when I put on my real shoes that I can walk in. But when it comes to the plaque and the scar tissue development in the brain, it adheres all of our neurons together. And when our nerves are kind of scarred together, they can't function. And when they can't function, we lose memory, we lose sensory or worsen sensory issues, we worsen motor issues, we worsen anything that the brain has to deal with, development, language, social issues, anxiety, etc., depending on what part of that brain is scarred together. Okay? These are the beta amyloid plaques that have been researched for a long time for Alzheimer's. Okay? And new research that's coming up, which is why these treatments are pretty new, is that these same plaques that are developed in Alzheimer's, and we know about this for a long time, are present in children with Down syndrome and present in children with autism. So if we can get rid of those plaques, we can reverse symptomatology in all these neurodegenerative conditions, whatever words we want to call them. Okay? So, lots of research, and I've got all my research, for those of you who like research, I've got all my studies cited. There is a lot of these APPs, which stands for amyloid precursor protein, in children and people with Down syndrome, and people with Alzheimer's, and people with autism. And again, what those scar tissues do is glue everything together. Okay? So we inhibit circuit formation. The brain actually makes circuits, like on a circuit board for your computer. The neurons move. The neurons connect. Okay? How come I can walk and chew gum at the same time and ride a bike and a unicycle or whatever? Okay? Because I've done it so many times. The neurons in my brain connect together because they know I'm going to do this repetitive activity. So they're moving. They're moving inside of our brain. But if they're scarred, then you can't move. So it's perturbing or interfering with that axonal pathfinding. Let me find the path to that part of the brain that I need to go to. Okay? And again, as I mentioned, we know that the overproduction of this plaque, of these APPs, or amyloid beta peptides, which is a slightly different one, are the dominant role of dementia and Alzheimer's. It's also the dominant role in memory loss and neurological sensory motor developmental delay issues in children with Down syndrome and children with autism. Okay? What is interesting, as you've probably read, and I've got some cool MRI slides to show you, that people with Down syndrome, once they get to the age of about 40 on average, have the qualifications to be diagnosed with Alzheimer's because the memory loss is so severe. Okay? Now, let's take a step back and talk about generalities. Okay? When I talk to my patients about how we as a society think about illness or disease or whatever you want to call it, we normally walk into the doctors with symptoms. Okay, I'm tired, and I've got some anxiety, maybe it's some depression, I got some memory issues. Okay? Now, we could just choose a drug or a supplement or something to fix that symptom. Hey, I've got high cholesterol. Well, here's your Lipitor. Hey, I can't breathe. Well, here's your albuterol. Okay? I've got a headache. Here's your Advil. All right? That's pretty much where medicine is today. You've got a symptom, I've got the solution. We don't even take a step back and ask ourselves, as you see on the flowchart here, what caused those symptoms? There must be a physiological reason that these symptoms are here. And we only call them symptoms because we don't like them. Okay? Hey, I feel happy right now. Well, that's not a symptom because I want to feel happy. I'm sad right now. I don't want to feel sad, so it's a symptom. Okay? There's a reason that these physical, emotional experiences are happening in the body. And they normally occur because of some change that the body's making that's caused by inflammation. Okay? Back to my foot. Why is that callus there? My body made that callus. Why did my body make that callus? My body made that callus because I kept stepping funny on it, and it wanted to protect itself. The body's always trying to stay as healthy as possible. Okay? And there's that innate knowledge that the body does things because that's what helps it stay alive. Okay? So now let's ask ourselves, why is the body creating this plaque tissue in the brain? Okay? It just doesn't happen. The body's doing it. Okay? And then we take a step back, which I kind of talked about, and you want to determine your etiology. Again, for my feet, my calluses, my bad shoes. Okay? We don't really know for all cases what's causing the neuroinflammation that creates a scar tissue, but we're learning. Here's a neat little graph for those of you who like pictures, and I love pictures. If you look at the top, there's a picture of trisomy 21 that's leading to neuroinflammation or inflammation in the brain. Okay? That creates a cascade of those little chemicals. Actually, the chemicals in the middle are called IL-1. Interleukin-1 is a pro-inflammatory cytokine. And for those of you who use homeopathy, there's really neat new homeopathic cytokines that they're creating that will affect cytokine expression. So you can have a homeopathic of 9C interleukin-1 and reduce expression of interleukin-1 from the white blood cells. So it's really, really neat. Anyway, those cytokines are just the communication of the immune system that eventually, if you follow the right of that picture, increases the production of those amyloid precursor proteins, those APPs, and then we got scar tissue. Okay? So there is a part, based on this picture, that trisomy 21 is creating inflammation in the brain that's creating this plaque tissue. Let's keep going down our philosophy. This is a very simple chart, graph, that explains how the body goes through its healing process in acute illness. Okay? Now, what we're dealing with neuroinflammation and plaque is chronic, but give me a second to walk through it. So if you go from left to right, the first thing that happens in acute illness, let's pretend it's a cold or a stomach bug or a virus, okay, is the incubation of that illness. Let's say it's a virus or a bacteria. Somebody sneezes, we inhale it, and those little bugs start to grow. That's the incubation. Next, our body feels that we are infected, and it starts to attack it. Okay? We mount a fever. We create antibodies. We create white blood cells. That's the aggravation. Our body's responding to this organism or this pathogen or what it thinks shouldn't be there. Then at the top, there's destruction. Hopefully of the virus and not of the host. But only one shall survive. 2 go in and 1 go out. Then the virus, the bacteria killed off, and we have the phase what's known as abatement. And abatement is the cleanup phase, okay? We're done with the illness, but now we got to get rid of all of those helpers that we used. So all those white blood cells that we created, we need to get rid of. That's mucus, that's congestion, that's everything that we cough up. The fever drops down, and we clean up. Then what the body does is reconstruction. Anything that was damaged, the body replicates. So you had strep throat, and you have all of these destroyed throat cells, well, the body's going to remake them. Okay? So this is what happens in acute illness. But with chronic, long-term illness, we deviate from this graph. Where's my red line? There we go. We deviate from this graph where there's no destruction or immediate destruction of organism or host, but we just go into chronic inflammation. The aggravation continues and continues and continues, and the body, in response to this chronic aggravation, creates scar tissue. Okay, again, back to the callus on my foot. Initially, it wasn't a callus. Initially, it was a big red blister. That's the aggravation. Okay? But then I kept injuring it, and it developed a scar and a callus. That's how our body deals with chronic inflammation. And that's what's happening inside of these brains of our children and our adults and our parents and our grandparents, whether it be inflammation that we then call Alzheimer's, whether we then call it Down syndrome, whether we then call it autism, this plaque is developing. Okay, enough of that. We're looking for the answer. So, before we get to the answer, how we can function, how we can do something about it, here's the second thing I want to ask you to do today. The second thing is to be inspired. And I get inspired every day in my office when I have these huge changes. Okay? I mean, I think of myself as a connector. I've got parents with kids who need help, and I know of all of these different treatments, and I try to connect the best one that will fit. Okay? And when it's a huge response, it's awesome. And it's inspiring. And I hope you guys go to the different lectures and are inspired that there is hope out there. Okay? So be inspired, and then of course you go online and you hear all these inspirational stories, and be inspired that there is a solution. Maybe the one solution that worked for that person won't work for you or your child, but something will. Right? I had a girl come in this week who I had seen for a year, and she was moderate to severely autistic, and she was just so active and so violent and so aggressive, and she'd scratched her skin because she couldn't handle her sensory overload. And we tried everything. We tried everything I knew how to do, and we got nowhere. And then finally, a couple weeks ago, I tried something different, and it worked. She came back in, she came in today, and usually she would scream for the entire visit and run around and hit her head on the wall. And she just kind of stood there and played. I mean, in my office, I got a trampoline and chalkboard and slides and blocks and stuff, and she just sat there and played. Like, finally, we discovered the one thing. We discovered the thing that would help this child the most. So I wish that for you. So please be inspired. Okay, I was teasing you. Before we get into the solution of how we fix the scar tissue that's developing, I want to get into this picture. This picture is some written text. I'll read it for you. It looks a little small. These are the symptoms of children and people with Down syndrome that occur when there is this amyloid plaque formation. So I'll start from the top. The parietal lobe, that controls the sensory and the motor function. They have altered microarchitecture of the brain cells. In the frontal lobe, that's our feeling, that's our emotions. It has a reduced volume. It gets smaller, and there's fewer cells. Okay? In the hearing area, the temporal lobe, there's reduced volume. The brain is actually shrinking because the scar tissue is bringing all these neurons in and killing some of them. Okay? Down at the bottom, the cerebellum has hypoplasia and reduced number of cells. Cerebellum's our balance. What about all this gross motor function and fine motor function problems that we're having? Down at the very bottom, the brainstem, we have altered serotonergic and noradrenergic and cholinergic systems. That's a lot of juric words. It affects our serotonin levels that makes us calm and happy. It affects our norepinephrine levels that makes us focus, makes us concentrate. We always test dopamine levels in my office because dopamine not only makes you happy and enthusiastic, but it's also our reward chemical. Okay? How many of your kids could you say, I'll give you $10,000 to clean your room. Like, nah, I don't want your $10,000. It's the reward chemical. And when people don't have it, they don't experience those feelings of reward. So there's so much in the brain, physically, sensory, motor, and emotionally, that are going to be affected. Here is a biopsy slide of early onset amyloid beta plaques in a young child, actually a 4-month-old with Down syndrome. So you can see those two red things are the plaque scar tissue developing, gluing all those nerves together so that they can't function. This is one of my favorite slides that I have. This is another MRI where they inject you with a dye that highlights and lights up those beta amyloid plaques. So on the left you can see we have a 52-year-old neurotypical person who's used as a control. The second picture is a 23-year-old person with Down syndrome. And then the third one is a 59-year-old person with Down syndrome. And then the final one on the right is a 50-year-old with Alzheimer's. And just take a look at how much that brain lights up. The more it lights up, the more plaque and scar tissue they've got. Okay? So as you age, the plaque tissue continues and continues and continues to develop. Symptoms get worse and worse and worse and worse until we fix the problem and stop the cause. So here's just another final picture of that plaque. I put this one up here because it has a little pirate. Okay. Because not only is the plaque, isn't this a dark picture? It's got a black background and skull and crossbones. That big plaque that's red in the center of the picture there, not only gluing all the neurons together, also secretes some chemicals that ends up killing the brain cells. Now, we've got lots of brain cells, but might as well use what we have. Okay? A great quote that one of my parents told me, not my parents, one of my patients' parents, was that parenthood was long days and short years. And I find this such a great quote, and again, as a parent myself, because there's just some days you just want to tear your hair out, and you're like, oh my gosh, when is the day going to end? And then all of a sudden they're grown up, and all of a sudden that phase is over. So, you know, I personally am really trying to appreciate every moment that I do have, and so I hope you guys too. It's easy to be frustrated with being a parent of any child, but you know, really grab on to what you can. So this is my wife and little daughter there. So she's happy, and when she's happy, I try to enjoy her happiness as well. Everything's new to her. She's like, an orange. What is that? Oh, it's delicious. Okay, is this number 3 or number 4? Number 3, enjoy the smiles. Okay, when the children are happy, when I see this, my day lifts. So when you've got your child there and they're happy, enjoy that moment and be in it. Okay. Next case study, or next story, the 9-year-old who wanted it all to end. A mom brought in her child, and often just because of the profession that I'm in, we get the people who are looking for the last resort. And her 9-year-old boy was suicidal, but really suicidal. I mean, he wasn't doing this to get some attention or et cetera, et cetera. It was a great supportive family. There was no history of abuse or anything that would want him to leave his situation. And mom said they'd been dealing with this for 3 years. Since he was 6. That's all he would talk about every day. They had him on every med. They had him on the psych meds, the antidepressants, the Wellbutrin, the benzos, the ADHD meds. Nothing helped him or made him worse. Okay? And mom just felt, he's getting older. He's going to be more physically able to do something if he wanted to do it. So, again, we did our full battery of neurochemistry, et cetera, testing that we did. And one of the tests that we normally do are genetic tests. And we found out for him that he had a genetic mutation in a gene called MTHFR. Now, MTHFR and methylation has been really popular lately. How many people have heard of it? Okay, wow. See, almost all of you guys. That's awesome. All right, MTHFR has just blown up the past couple years. So luckily, when I had met him, I had heard about MTHFR testing. Of course, we tested his MTHFR. He had the mutations, and we gave the treatment, which is methylfolate, and literally that week, he was happy. And his mom would just came back in tears, and she's so overjoyed. She said, we found the thing. We found the one thing that was causing all of this for so many years, and we can do something about it. And he's been great. When I originally saw him 3 years ago, the treatment's still working. I mean, he still has to be on the treatment because he inherited a genetic mutation, but we found it. We found the one thing, and that can happen for everybody. So, number 4 is make sure you love. Make sure you love your child. Make sure you love your family. When things get tough, just remember that love that we have, because that love is going to keep you guys searching for what you're looking for. Okay? Obviously, you're at the conference for some kind of answers. Keep searching, keep looking until you find that. Okay? And what drives us is our love versus our fear. All right, let's get back into how we're going to take care of all of this stuff I was telling you about with skull and crossbones and things. So, as you remember, the plaques develop because of prolonged inflammation. The treatment that we're going to use, which is pretty new, is called Trehalose. Okay? Trehalose is a disaccharide. And I use the word disaccharide because sugar is a bad word. It's a complex carbohydrate. It's 2 sugar molecules glued together. Okay? And what this Trehalose does is activate the part of the body that eats these scars, that eats these plaques. Okay? So our body can remove the plaques. If I go get my old shoes, my callus is going to go away. How did it just go away? Okay? The body reabsorbed it. The body ate it up with ribosomes, technically. So Trehalose increases the body's own eating of these scar tissues and plaques. Okay? It's currently, where I discovered it, it's currently in phase 2 trials, I believe, to treat Alzheimer's. It's reversing dementia. Okay? People are getting their memories back. They can't access that memory because those neurons are glued together. But then once that scar tissue is gone, the memory returns because the neuron can function again. Okay? So it's not out on the market yet as a drug, but it's out on the market as a supplement. Okay? So I said to myself, hold on, I'll say to myself in a second. This is a little biochemical graph that shows glucose on the top left and trehalose on the top right. Glucose can become trehalose. It doesn't happen much in humans. It happens a lot in animals. But we can activate that process by adding heat. The hotter the body, the more conversion of glucose to trehalose. Okay? Just think of making a crock pot dinner. Okay? I've got this big piece of meat, and I want it nice and tender, and I want, all these little bonds and scar tissues to be melted away. So I put it on mild heat. I just let it simmer for 10 hours. Then I come home, and there's this delicious, delicious meat that has all the scar tissue dissolved. And that's why the meat just falls apart. Okay? That's happening in the brain. It's not going to fall apart. But we're going to dissolve that scar tissue. So you can activate your own trehalose production by increasing heat. You can increase heat with a fever. Okay? We have such a fever phobia in this country. No, it's a fever. Get your Tylenol out. Okay? Work with the fever, and then hot tubs, saunas. Build that internal heat. All right? That's going to help. Little more details for those of you who like the sciencey stuff behind it. 60% of children who are severely autistic have these huge elevations of this amyloid material and that APP alpha. There's brain overgrowth in certain parts of the brain and brain destruction part of the brain in almost all these kids. And then there's these other markers of the plaques called amyloid beta 1740, amyloid beta 1742, that not only prevent new memories and new function and new connections, but also scar everything together. They themselves are neurotoxic, so they're destroying the brain, and then they just create more plaques, which I talked about. But not only are they creating the plaques that glue the brain together, they're actually destroying the brain cells. And these are memories that never come back. You destroy the neuron that holds that memory, it's gone. Okay? So again, as we mentioned, this APP is response to brain injury or toxins. We didn't talk about what caused it. We said, whoa, okay, this is all happening, and it's inflammation, but where does it actually come from? It can come from a myriad of things. Okay? I think the biggest one is toxic exposure, but there's also a lot of glutamate toxicity out there. One of our major sources of glutamate toxicity is MSG. Okay, and I'm sure many of you are familiar with MSG and how it's in so many of our foods, and in the ingredient list it's just called natural flavors. MSG is extremely toxic to the brain. Okay? And I also think we have an autoimmune reaction to it because so many of our vaccines contain MSG. So when we get injected with a vaccine, let's say I get injected with polio. Okay, what happens? Boom, I get a polio vaccine. I make all these antibodies to polio. That's awesome. So if I ever get polio, then my antibodies will kill the polio and I won't get sick. That's awesome. Okay. But what if I inject MSG into myself as a baby? Do I then develop these little antibodies to MSG? And then any time that I eat MSG in these foods that's hidden, all of a sudden my immune system attacks it and causes all this haywire? Okay? The possibility's there. Great. This is more of the sciencey stuff. Again, I'm a clinician. I'm not a researcher. All right. So our goals, what is our goal? We talked about this plaque. We want to get rid of it. So we wanted to use the Trehalose. Okay? Talked about that. Let me come back to this. I want to get to this and then the study. Well, I guess I could talk about this really quick. The actual function of the Trehalose, before I get into the exciting stuff, is as an mTOR-independent autophagy enhancer. Wow, that is a mouthful, okay? What does this all mean? mTOR is an enzyme that helps degrade this kind of scar tissue. And there are drugs that work with this enzyme, but they're more for cancer. They really haven't tested them for Alzheimer's yet. So if you do any kind of research, you'll understand that mTOR is being used a lot to help destroy the scar tissue, but Trehalose does not work with this mTOR enzyme. Okay, it's totally independent. So it's an mTOR independent, and autophagy is just the medical term for eating your own self. Okay, let's eat that callus away so it goes away. Let's eat the scar tissue. That's called autophagy. So it enhances the destruction of this scar tissue and plaque tissue. Okay? All right, so let's talk about using it as a treatment and as a supplement. Because it is a disaccharide, it's classified by the US FDA as a food. Okay? Trehalose is mostly used in baking. Does anybody use Trehalose to bake? No. Okay, you can go on to Amazon and get it on your spice rack. You probably won't find it in your supermarket. But Trehalose, as a complex carbohydrate, is sweet. So it's mostly used in baking. So the FDA has already looked at it and said, this is just a general food, and it gets the GRAS rating. GRAS is the term for generally recognized as safe, the most innocuous rating the FDA will give to a substance. Okay? It's been tested safe in doses as high as 50 grams per day. And really the only side effect from it is that some people can't digest it. Just like some people are lactose intolerant because they don't have a lactase enzyme to eat it up. That's why we take Lactaid milk and Lactaid enzymes. We're digesting that double sugar, that lactose. We also have a trehalase enzyme that digests the trehalase, and about 15-20% of people don't have it, and so you get the same symptoms of lactose intolerance: big bloating, gas, stomach pain, etc. Okay? Here is a really important graph on insulin response to Trehalose, just if your patients are sugar sensitive or have cortisol imbalances. This graph shows an insulin level or insulin spike over time. The blue line is when you ingest glucose or sugar, okay? You ingest sugar, you get a big insulin spike. The red is Trehalose, and the blue is placebo or control. So you can see as a complex carbohydrate, as a disaccharide, the Trehalose is increasing insulin levels, but just very slightly and at approximately the same rate that it would if you ate a complex carbohydrate versus a simple sugar. Okay? So very safe, very innocuous. Again, as long as you can digest it. What I don't know yet, but I'm going to be trying soon, is for people who can't digest it, would giving a digestive enzyme help? Okay, and I've never seen a digestive enzyme with Trehalase specifically, but these enzymes do have cross reactions on different bonds. So why wouldn't lactase work? So I read all this stuff about Alzheimer's, and most of my patient population is kids on the autism spectrum. And I read that they have plaques too. So I said, well, if it works for Alzheimer's, why wouldn't it work for kids with autism? So I did a little study. We took 12 kids, and we gave them Trehalose every day for a month and a half. And we used the ATEC form, the Autism Treatment Evaluation Checklist from the ARI. It's a survey form that looks at language and sensory issues, etc. And said, let's do a survey before and let's do a survey after and see what we get. Okay? Now, 5 kids dropped out of the study because of that stomach pain. They didn't have the enzyme. They got all this gas and bloating. So we only had 7 kids go through. A small study, but at least it was a start. And we found really great results with everybody. Okay, all 7 kids had pretty much the same level of improvement in the same areas. It wasn't like we had one kid with huge improvement and one kid with worsening improvement. Everybody improved a little. So we had a 10% improvement in language. We said a 14% improvement in social interactions and decrease in tantrums. We had a 12% increase in cognition. Okay, for those kids who were just totally in their own world. Oh, your mom, hey, you're here. I didn't notice. And 12% improvement in general health. And again, these are the categories on the ATEC form. So it's really interesting that the Treehallows could help so much so quickly. Okay? We obviously need to do more studies, do it with placebos and controls and such. This is just an open label pilot, but it's interesting because all that research is there for Alzheimer's, et cetera. Do you have a question? No. That would be good. All right, so Treehallows is that new treatment that I think is going to benefit so many people, especially children or adults with Down syndrome, because if you go back to those MRI pictures, you're going to develop these plaques. It's happening. It happened in that 4-month-old. That first picture I showed, the 4-month-old had amyloid plaques developing. Okay? It's not a treatment that I think you're going to see overnight success, 3 weeks on thyroid hormone and I'm walking. But I think as a long-term treatment / preventive, it's got very good potential. Again, we don't have the research to back it up, but it's making sense. Okay? So the 5th thing I want you to do is to prepare for that awakening. Prepare for that child to stand up and walk in a few weeks and to do these amazing things. The before and after picture of your son I thought was just awesome. But like, that's you photoshopped that or something. So prepare for that. When you find that one thing, you get that one big change. The child who wouldn't leave the mother's side is now doing his own thing and playing for a half hour. The 9-year-old who wanted to commit suicide is now happy and doing chores and has friends and girlfriends and living life to his potential. So prepare for that. Okay? It can happen. The other treatment that I want to talk about in parallel with Treehallows is inositol. Okay? I bring up inositol. How many people have heard of inositol? All right, good. A lot of you. Good treatment for cortisol imbalances. Good treatment for, what is it? Is it uterine complaint? Somebody help me. Anxiety. But there's also a female, PCOS. Thank you. I don't do gyne or treat mothers, so I forgot that. Anyway, inositol also has some good research in the Alzheimer's world. Not as far as the Treehallows, but that's the next supplement that they're investigating. And they're seeing improvements with the inositol, not in removing these plaques, but in preventing their new formation. Okay, so what a great preventive. If I've got this scar tissue and this dementia, these memory issues and sensory issues, and more is coming, at least I can intervene. I can intervene on that physiological level and stop more production. I can stop worsening of it while I try and erase it and dissolve it with some of the Treehallows. Okay? So there's many different forms or isomers of inositol. The one that has the research behind it is called siloinositol. I don't even know if I'm pronouncing that correctly. But that's the one that you'll find in the research. And it's not really available as a supplement. But what is available as a supplement is myoinositol, which is a very similar isomer of it. So the question is, will the myoinositol work the same as this siloinositol? Okay? Now, if you do want to eat siloinositol, you can find it in purple yams, eggplants, artichokes, escarole, and endive. Delicious. It sounds like candy to my child's ears. Oh, finally. That's the joke you laugh at. Okay. What is one research study that I did read that I thought was really interesting is that the two isomers can convert back and forth to one another when exposed to certain probiotics. So certain bacteria have enzymes that will convert these isomers back and forth. So as you can see, the only difference between these two forms is that bottom left carbon, a bottom left hydroxy group. Bottom left hydroxy group in this inositol is in one formation, and the another inositol in the opposite formation. So physically, it's just attached at a different angle. So all those other 5 hydroxy groups around the atom, the molecule, are in the same position. Everything's in the same position, and then one guy is like, meh, okay, or like meh, instead of the other one. But bacteria can change that. So the ultimate question is, does that slight difference in molecule shape affect its effect in the brain by preventing plaques? We don't know. And will exposure to probiotics in the gut change the inositol form that you take? Will it change the myoinositol that you take as a supplement into siloinositol that then goes and has that effect? We don't know. But it's some really interesting thoughts to think about. Okay? So I think these two are some great new treatments, biomedical treatments that we can use to improve brain function and prevent worsening of brain function. Okay? So we need to dissolve that plaque. Okay? We need to prevent that plaque. So I give to my patients 3,000 milligrams of Trehalose and 3,000 milligrams of the myoinositol. And again, I don't see overnight changes, but I see steady changes. Okay, and often with the other therapies that I'll use, I'll get plateau effects. Be like, whoa, we're doing so well, and I haven't changed yet. And then we do something else. We're like, whoa, look at this is great, and nothing changes yet. Okay? The Trehalose and inositol is steady, slow improvement and prevention. So I think it's a really, really neat new therapy to think about, to try, and hopefully future research studies will kind of elucidate how it works for everybody. The great thing is, besides the potential GI gas and bloating, there's no side effects to either. Okay. So, as a summary, the 5 things I need you to do. Okay? Well, 6. 6 things. Find out what is your passion, what is your drive, and do it. Is it your child? Is it your family? Is it your work? Is whatever it is, what is your passion? And make it your everyday. Okay? The next thing is be hopeful. You're going to hear stories all weekend long of miraculous happenings. Those miracles do happen, and they can happen to everybody. So be inspired by those. Okay? Enjoy your child. Enjoy the smiles. Enjoy the love. And prepare for that awakening. When you expect it to happen, more likely it's going to happen. So thank you, everybody, for coming, and God bless. Yes?
Are you finding the plaques on the MRI?
You can. I don't want to put the kids through them. I just treat and watch improvements. So I'm just using symptom improvements. We could do cerebral spinal, we could do spinal taps to look for these, but I'm not going to put anybody through an MRI or a spinal tap. I'll leave that to the researchers in the back. I'd say 20. 20. So I'm sorry. I'll start repeating the questions. My fault. The question was, how many children with Down syndrome have I treated with the Trehalose and inositol combo? About 20. I don't see a huge number of people with Down syndrome in my practice. It's mostly autism and PDD, but we do get a fair number. Back again.
In your research looking into the Trehalose, have you seen any data looking at Trehalose effect on the beta-amyloid plaques in the gut?
No, but you piqued my interest. I know what I'll be Googling tonight. I don't see why not. But I haven't. Oh, I said I was going to do it, and I didn't do it. Okay. The question was, have I read any research about Trehalose affecting the beta-amyloid plaques in the gut versus the brain? I haven't seen any research, but I wouldn't see why it wouldn't affect it anywhere in the body. I mean, you're getting into the bloodstream and going around.
Do you see any potential benefits of Skowron for Parkinson's?
I don't know. I don't treat people with Parkinson's, but it'd be worth some investigation. I just don't know. In the front?
Your study said they did for a month and a half.
Yes.
How long is treatment plan they've done, or is this an ongoing treatment plan with children?
This is normally an ongoing treatment plan I have with children if they can handle the digestion of it. Because this is pretty new for me, I want to say the longest I've done is 4 months.
And if you don't see the improvements over how much time would you kind of give up on this treatment plan?
So the question is, when would I stop? And this is a great general question. How long do you give a treatment to evaluate its success? For the Treehalose, I would give 2 months. Most of my treatments, I give 1 month because they're faster, but this is a slower treatment. I'm going to bounce right back. We've got a hand way over here. Question is Treehalose oral only? I don't know.
The reason I ask is, would Treehalose be absorbed intact across the gastrointestinal, or would it be broken down to, because you said it was a disaccharide?
Yeah, the question is digestion. I was having a conversation with somebody else in the room today about that. We aren't exactly sure what happens with Treehalose. The body has Treehalase enzymes. So we know that it must be digested, or perhaps digested. So therefore, the individual glucose molecules or the Treehalose itself are going to cross. But I don't feel that all of the Treehalose is digested because there is research that shows our cells have Treehalose receptors. So if we have a Treehalose receptor, it must have once upon a time contacted Treehalose, or I feel like it would be downregulated. So is the body digesting all the Treehalose and absorbing that? Is it absorbing some of the Treehalose? Is it reforming it inside the body from random glucose that's floating around? I don't think we know. And I don't know if Treehalose is available as IV or other kind of treatments. We just use it orally. I don't see why not. I don't see why it couldn't be. Front here, and we'll move backwards.
So do you recommend sauna treatment after dosing to increase the efficacy of the Treehalose?
Question is, would you recommend heat therapies after the treatment? I don't think you need to do it right after. I think you could do it any time. Because the heat is going to upregulate the body's own production of Treehalose. It would make sense to do it right after a treatment. Or, hey, you're going into the hot tub, take some of this. Why not?
There's a company called Nanotech that sells a product called Ambertose. I don't know if is it similar because they also put forth that it helps children with Down syndrome.
I'm not familiar with the product. What are the ingredients? I'm getting old and deaf. I heard Machu Picchu.
Glyconutrient.
Okay.
They've been around a while.
Yeah.
They say that they help autoimmune disorders as well as
Right.
Down syndrome specifically.
Right. I've heard of the company. I don't use it in my office, and I don't know.
Is it similar to Treehalose?
I have no idea. What's the individual glyconutrient?
They call it Ambertose.
Right. Does anybody know, is Ambertose a disaccharide?
I'm Googling it right now.
Google it, and I'll come back. Let me hit the corner and wrap around. Okay. So it was a comment on the additional sugars. I haven't hit the middle yet, in the back. So the question is, will a disaccharide enzyme digest the Treehalose? Probably. I've never tried it, but I think it's a good thought. And I don't see why not. We just have to find the enzyme that breaks that bond. So the question is dosage for geriatric population with Alzheimer's. The more you give, the more it'll help. Okay? And again, it's proven safe up to 50 grams a day. So it is dose dependent. So I'm not going to limit you and say, stop here. Stop helping at this dose. So I think divided up the dose throughout the day is going to be more effective than one lump dose, but I'm just hypothesizing that. The next question is, where can you get it? Again, I'm developing, let me fast forward here. Hey, who likes research? Research! I will do whatever Autism One tells me to do. And I hope that they're available. And do we have it on webinar, Dr. Pearson, eventually? Fantastic. These will be posted online. So where can you get it? Again, I'm developing a little special needs supplement company called Spectrum Awakening. So it'll be available as Super Trehalose in July. However, you can get trehalose as a spice anywhere that you buy spice. You get online. What can't you get online? Hey, Viagra. Hey, trehalose. I have not figured out your humor yet. And I just blanked. There is another company, North American Farm Cal, that has trehalose mixed with ribose. So that's a supplement I believe called Trehalose Complex. Those are the three places I know. Maybe there are others.
Do you recommend taking the Instacol and trehalose and probiotics simultaneously?
Yes. So the question is, do you recommend taking trehalose, inositol, and probiotics simultaneously? Yes. Thank you. I like easy ones. Okay, the question was, are the plaques associated with epilepsy the same as the plaques associated with Alzheimer's and children with Down syndrome and autism? I don't know. If they are, the treatment will work. Does anybody know the exact type of plaques for them? They're not the same. Sorry. The question is dose of kids versus adults. The trehalose is going to be dose dependent. So the more you use, the more it'll work. There's no set recommended dose. I think just like melatonin. Why is melatonin 3 milligrams? Because the first research study was done with 3 milligrams. Somebody just picked it out of the air. I think the same thing is with trehalose. I think we picked 3 grams out of the air, and that's what people are generally using now. So it's really just the more you use, the more of an effect that you'll get. The only thing you have to watch out is the GI distress. And there's no toxicity to it, so it's not like there's a ceiling for kids. So the question is, what age do you start? Because of that study I saw of a 4-month-old with these amyloid plaques, I would start right away. I would start as soon as the child can tolerate it. Because that plaque tissue can be occurring so early in life. And even if the symptomatology isn't there yet, we can prevent it from happening. And again, that's just my guess. I mean, we haven't done the research on it, but I don't see why not.
In your treatment with the children with autism,
Yeah.
do you study any of these, watch the yeast levels? Does it make the yeast levels rise?
So the question is, will yeast levels rise with trehalose or other type of complex carbs? I haven't seen that yet. We do treat a fair amount of candida and yeast and parasite and GI infections and such. We're pretty successful with the herbs that we use and the biofilm enzymes and probiotics. I haven't seen a flare-up yet. So, the comment, which is entirely true, was this was a pilot study that we did with just 7 kids. We didn't have a control group. We didn't have a placebo. There was no double-blinded. So are these numbers accurate, or are these numbers because I said, they're going to do great, they're going to do great, they're going to do great, they're going to do great? That's a great question. That's why I want more research done. Sure. Would people like an online source for trehalose? Half pound to 50 pounds. Endowment Med. EndowmentMed.org. And again, I've seen trehalose on Amazon as well. There you go. A lot of research. EndowmentMed.com. Thank you. I haven't heard of them. I'm not plugging them, but I expect a royalty soon. Yes. I believe it does. I'm not exactly up on the physiological effects of resveratrol. I know it functions as antioxidant, so you're going to get some kind of neuronal repair that way. Okay. Any last questions? I didn't even. What time is it? Did we run over, Dr. Pierce? I don't want to run over on anybody. Okay. 1:56. Any last question? One more. One more. Yes. So the question is, where can we get glutamate from and will it affect you? I mean, glutamate is in a lot of things. It's in processed food as an additive. It's in certain foods as a natural substance. And I feel that if you get it, it's going to act as a neuroexcitatory stimulus. It's going to rev you up wherever you get it from. The same thing, I've been doing a lot of work recently because it's allergy season, with histamine. And not only the histamine that we create when we're exposed to our environmental allergens, but the histamine that we get in foods, in ketchup, in sardines, in a list of foods. And now my allergy symptoms are worse, but I don't have an allergic reaction. I'm just eating histamine that's creating that. And there are digestive enzymes that digest histamine, which is pretty cool. So I think it's very similar. Wherever you get it, it has the effect. So thank you very much. It's a pleasure. Enjoy the weekend. And I hope to see you next year.